pancreas to produce more insulin if your body isn't making enough. It also works on the brain to make you feel more satisfied when you eat food, so that you feel full sooner, and therefore you can actually consume fewer calories. It also works on the liver to reduce the amount of sugar that's being pumped up in the bloodstream. So can we actually take this natural hormone that looks like this? This is the 37 amino acids. So every amino acid is a building block that builds a protein, and this protein together forms this natural hormone that we all have. But our body breaks this hormone down in about 2 minutes. So if I inject it into your body, in 2 minutes the body would have cleared it. But what the pharmaceutical companies have been able to do is change just 2 of these amino acids. So change the amino acid here and the one here, and put a tail on this side. And by doing this, suddenly the half-life, meaning how long it will last in the body, is now 1 week. Okay? So this natural drug, the drug looks 94% like the natural hormone. Okay? So this drug is called semaglutide. So this is a new medication. That's the version 2 of liraglutide, but this is a once-weekly treatment and is now fully reimbursed in Ireland. And in fairness to the HSE, we were the second country in Europe after Denmark that actually got this drug. We got this drug before Germany, before the United Kingdom, before France. So this is really something that we should be proud of. What happens if we give this medication to people? So this is a study over 3 years, or actually 2 years in this instance. So this is the hemoglobin A1C, so this is the blood sugar level. So what it shows is people who are very sick with diabetes, with hemoglobin A1Cs above 8.5, you can reduce that to almost normal levels. So this is 7%, which is what we want to achieve, and it's sustainable as long as you use the medication. The problem with all medications are they only work if you take them. So if you don't take the drug anymore, it stops working. But what we really want to do is not only make somebody's blood sugar better, we also want them to live longer. So this is the same study showing how many people have had heart attacks and strokes and death. And what you can see in those people that had the semaglutide treatment in the dark blue line over here, there was a statistically significant reduction in the number of people dying of it, having heart attacks or stroke. So this is really revolutionary when it comes to treatments. And of course, what we are very interested in, the same treatment, because it works on the part of the brain that makes you feel hungry or makes you feel less full, it changes that. Because it does that, it also causes weight loss. Now what you will see over here, and I really want to focus on this 15% weight loss over here. This is the treatment that's available at the moment for diabetes. And what you can see, almost 18% of people, so 1 in 5 people, are able to lose 15% of their weight. Okay? And it becomes even better when we actually look at over here, 1 in 10 people are able to lose 20% of their weight with this medication. So that really is a game changer from our point of view, because it means that we can actually help people become healthier because we reduce their blood sugar. We can make them healthier so they have fewer heart attacks and strokes, but we also can help them lose weight that improves their quality of life. So if we actually conclude, what I will say is that diabetes and obesity are systems diseases. So it means it affects all the systems in the body. And new medicines can reduce blood sugar, body weight, and death from heart attacks. And personalized medicine tries to get the right treatment to the right patient at the right time. And that's the challenge for us, because right now, we can't do a blood test that tells me whether or not you're going to respond to this treatment or not. I can't ask a questionnaire that will tell me if you're going to respond to it. So the only way we can do this is if we actually treat people for 12 weeks and then decide. And many of you who are in the STRIVE study for those that don't know, is a study that actually looks how we can use these medications in a cost-effective way and a maximum benefit. Because all these drugs have side effects. And what we do not want to do is we don't want people to have side effects if they don't have benefits. So we stop the medications if they don't work, because that way we actually only have the benefits without the side effects. So let me throw that open to you now. So if we can actually, and those are just some of the references that you actually will see today, some of the websites if you want to take that down, I'll leave that up. But any questions? What do you guys think about some of the medications that are available at the moment? And has anybody actually spoken to you about some of the medications that's available for the treatment of obesity or for the treatment of diabetes?